Excellent. Here we are. We are live here, folks. LinkedIn Live through SDV Medical. We are running a session today called Introducing Optellum to the VA. And Optellum is driving and working to solve lung cancer. And I'm personally extremely excited about this session. The technology is absolutely amazing. I'm a bit of an AI freak myself, so I love hearing about this technology, and I think you're going to love hearing about it as well. So my name is David Manica. I do business development marketing here at SDV. I'm going to go ahead and introduce our two guests. First, I'm going to introduce Jonathan. Jonathan, why don't you go ahead and introduce yourself and tell the folks who you are.
Thanks, David. So I'm Jonathan Watkins, the CEO of Optellum, a lung health AI company based out of Oxford in the UK and Houston in Texas. So real pleasure to be here and discuss how our solution in partnership with SDV can help veterans and their families.
Jonathan, thank you so much for taking the time to be with us. I know you're incredibly busy. And the same for you, Dan. Dan, why don't you introduce yourself to the group?
Thanks, David. Dan Wisnant. I'm a co-founder and CEO of SDV Office Systems and SDV Medical. Our SDV Office Systems handles furniture for the VA, and then our SDV Medical partners with companies like Optellum and other companies that we'll talk about throughout this session to really bring access to care, great care, standard of care for veterans, Marine veteran of 32 years as well. And just really happy to be here and have this conversation today.
Dan, thank you so much. And you've got experience in a number of tours as well. So we're going to talk about this lung cancer thing. We're going to talk about the effects that, some of those actions and activities in the Middle East had on our veterans and why this is so important. So with that said, we'll start with Jonathan. So tell us about what Optellum does. What do you do?
Yep. Thanks, David. And thanks, Dan, as well. So if I headline it, what we do at Optellum is we help providers diagnose lung cancer earlier and more efficiently. Mm-hmm. And as a result, patients have the best possible chance of survival. And the way in which we do that is by deploying our AI-enabled software as a medical device, Virtual Nodule Clinic. And Virtual Nodule Clinic does two things. So number one, it surfaces and helps track patients with a reported measured lung nodule so that these patients don't slip through the cracks. And then number two is it assists providers in deciding the next optimal step for these lung nodule patients by providing a radiomics deep learning based readout of how likely a given lung nodule is to be cancerous or benign. And combining these two elements is absolutely crucial. If you just have one but not the other, then you're really losing some of the synergistic impact you can have from having both of those together.
And I'm looking forward to getting in depth on this. Wait, folks, to hear some of the way the technology works and how it supports and how early stage diagnosis is just incredible. So Dan, we want to get this to the vet community. So how do we help Optellum serve patients in the DoD and the VA? What are we doing?
Yeah, so we bring really three things to the table when we partner with Optellum. We bring expertise. We know the government procurement system, the government contracting pieces. We've got a deep bench of personnel and experience of doing that. We bring simplicity to the process. Most commercial companies aren't familiar with how the U.S. government buys and how they contract and how they procure. We know that, and so we simplify that for them. And really then we speed that up for both the company and the VA with good contracting solutions that allow them, once they say, yes, we believe in this technology, this is going to do great for our veterans, we want access to it. And so we help speed along that procurement process as we go through the selection of not just the right contract solution, but also the right technology on that contract solution.
Yeah, and basically driving awareness that this type of technology is there for those veterans, right? Right, Dan, that's a huge part of this too, in helping Optellum get that access to the vet community. So, Jonathan, why did you select us? Why did you select SDV Medical to drive your phenomenal product into the VA and DoD?
So I'm going to reflect a little bit what Dan said there. The first thing is that expertise, that knowledge about how to navigate what, at least from an outsider's perspective, can look like a very complicated system.
Oh, yeah.
So I think that expertise, leveraging that expertise, is huge. The second thing is SDV's extensive network within the VA and also outside the VA as well. I mean, the way that we came together was through Intuitive, who is a mutual partner. And I think Intuitive really value the partnership that they have with you guys. So that is a huge element of credibility for us. And then the third thing is values. The values that SDV Medical has around best serving your customers, the VA, but also, of course, their patients, the veterans and the families that they serve.
Yeah, and that is certainly our ethos. There's absolute no doubt about that. With multiple veterans working for the organization, and Dan with many stories of both of his veterans, friends, and folks who reported to him and the challenges they faced throughout their lives, which we'll hear a story towards the end here on that. So back to you, Jonathan. So let's get into this thing now. Tell me more about Optellum's product line. What are the critical outcomes you're driving by your products? How are you making a difference? Let's talk about it.
Yeah. Thanks, David. So as I mentioned, virtual nodule clinic, that's our clinically available commercial solution. And as I described, that enables providers to diagnose lung cancer earlier. And we've seen impact along 3 dimensions from virtual nodule clinic. First, operational. We're helping providers more effectively, more efficiently use, for example, their robotic assisted biopsy platforms. And we do that through more appropriate patients, also better diagnostic yield as well. The second is clinical impact. So we're helping patients get diagnosed significantly earlier, as we just talked about. And that's massive because it leads to better chances of survival. And as we know, one of the big problems with lung cancer, the biggest unmet needs, is that you've got very poor survival rates, especially compared with other cancers. And then third, pulling all of that together is the financial impact. So all of what we just discussed means that you've got this reduction in total cost of care. You're shifting very expensive late stage treatment to relatively less expensive early stage treatment. Yes. And so that results in that total cost of care reduction.
Where you finally see that marriage between saving money and actually doing something in a positive light, right?
Exactly. It's a win on both fronts. Yeah.
It's like a perfect connector. And that, for me, that just really gets me fired up because the early detection, all the stories you hear for folks who pass away from cancer, they didn't see it, they didn't know it, they didn't know what was going on. And Dan will talk about that in a bit. And so, tell us more about your current customers. So you do a lot of commercial work as well, for sure. Tell us about some of your current customers and kind of impact that you're seeing.
Yeah, so a lot of our customers are seeing just that impact that we described. So we've got multiple health systems using our technology commercially, clinically, and they're doing so as well as part of studies, real world impact studies. So they're quantifying the benefit, the operational benefit, the clinical benefit as well of virtual nodule clinic. And a couple of these studies are being submitted for peer-reviewed publication, so there's going to be more around that, a bit more fanfare. But what I'll do is I'll give a couple of highlights. So, for example, one customer on the East Coast has seen that their times to biopsy, their times to diagnosis, have been cut by over half. So from 102 days to 50 days. So there's a massive reduction. And it's from that combination of surfacing patients, but then prioritizing those patients as to what you should be doing with them. So that's one example. A second example is a customer who's seeing an increase in the number of lung nodule patients being followed up appropriately in accordance with clinical guidelines. And as a result of that, you've also get a consequent increase in the number of appropriate biopsies, diagnostic yield as well. So these are some examples of some of the impact, the real world impact that we're seeing with our customers.
Man, yes. And we're excited to be able to start working to get that into the VA for our veterans as well. So Dan, you've been around the block. You've been doing this stuff for a while now into the VA, medical devices and technology. So from your experience, how has the VA traditionally handled lung cancer diagnosis? And how can the VA use Optellum's product to increase what we desperately want, which is those veteran positive outcomes?
So the VA, just like their commercial counterparts, have basically used watchful waiting when it comes to lung cancer. That's kind of been the standard. I would say, that's being challenged now by the introduction of these technologies and these capabilities, as well as within the VA ecosystem. When Congress passed the PACT Act, that then gave awareness to veterans and also access to care that's a lot quicker than what has previously been there. And then really doubling on those technologies that Optellum gives, as well as we'll talk about robotic bronchoscopy, Jonathan mentioned earlier, but the ION system that is by Intuitive allows caregivers to speed up that process, right? One, awareness, then gives veterans access to care, quick care, right? And allows those doctors then to have that impact that Jonathan was talking about. Because the last thing you want is to be in the unknown. That's not a good diagnosis. Between the technologies of the AI that Jonathan's going to talk more about, as well as ION, you can have diagnostic yields in the low 90s, as opposed to just guessing before, 50-50. I'm not sure if you have cancer or not. So now you can get on that pathway to care a lot more quickly as a veteran, which is great to hear. And great to be a part of.
Seeing, we talked a little bit about this before we came on. I mean, you have vets who served in some of the Desert Storm activities and the Middle Eastern activities that ran into a lot of toxicity, right? Both from the chemicals and the materials used to create the bombs and the IEDs and the burn pits that were out there. So I'm assuming, you're seeing this growth in vets coming in and saying, look, I got a problem.
Yeah. I mean, there's at least, I think, published studies right now. I think VA Boston put out a study. There's roughly 8,000 veterans getting diagnosed every year with lung cancer. Veterans have a higher prevalence of lung cancer because of the prevalence of smoking. But then obviously what you mentioned, the prevalence of exposure to burn pits, chemicals and things that are, IEDs. When we deployed, we'd walk into houses, we'd walk into, big buildings, and it was an IED factory, and you don't know what's in there. You don't have the PPE necessarily early on. Those early years, you didn't have those things to do those protective measures early on. So now that we're you come full circle here, you have access to this care and access to being able to say, yeah, I have it, right? That's first thing, is the awareness piece. And then how do you treat it after that? That's where we're at right now.
Man, it's got so much more to talk about. This is getting really good. So Jonathan, robotics is amazing right now, and Intuitive did that full robotic heart transplant down there in Houston just recently. We talk about the robotic ecosystem that SDV Medical is trying to push into the VA, as well as the Lung Cancer Alliance that Intuitive is driving. So tell me, how do you fit into that? How does Optellum fit into the Lung Cancer Alliance and this robotic world that we're seeing growing?
Yeah, thanks, David. So the first thing I mention is AI plus robotics, and AI for assisting the triage of patients who should go to a robotic biopsy platform like Intuitive's ION. That's going to become more and more common. And the reason for that is pretty simple. It's because you've got these two technologies and they really work hand in hand with each other. And as mentioned, if we talk about the AI first and how that then funnels into the robot, you've got more of these patients being identified, but then you've got more of these patients being appropriately prioritized as well. And so you get the right patients going to the right procedure at the right time. And that procedure obviously is something like the ION robotic bronchoscopy. And as a result, you can increase diagnostic yields. And we've seen this with, I mentioned, some of the customer impact we've seen. We've seen this, some of this impact in the real world. And ION's obviously the market leader, but there's other robotic biopsy platforms out there. But we've had a few real world studies where we've seen some of this impact.
Man, incredible. And Dan, one of the things that, we got a question here. How does this integrate with Vista CPRS, and will it integrate with Cerner? Jonathan, you want to grab that? So it says, how does this integrate with Vista CPRS, and will it integrate with Cerner?
So the integrations that we take is twofold. Number one, we do an integration with PACS because we retrieve the CT images. And then number two is that we do have HL7 integration. So we can pull some of the messages, some of the data that's flowing via HL7. And what that means is that we can get data from systems like Cerner, from Epic, but it doesn't mean that we're contingent upon being able to integrate into them, because HL7 can be agnostic of that. So at a very high level, those are the two integrations that we require. From that perspective, it can be quite light touch and doesn't have to be too onerous, especially from the hospital IT side of things.
Great. Thanks, Jonathan. That's fantastic. We got a question from the audience as we go through this. So, Dan, now we're jumping into a similar question, right? You're there. Your team is working. We're working on talking to VA medical professionals about the Lung Cancer Alliance, about the robotic ecosystem. I mean, we've done some amazing things with contracting to get that into both the VA and the DoD. So can you tell us more about that? Tell us more about what you're seeing, hearing from VA hospitals and how they're jumping on some of these trends, and specifically Optellum.
Yeah, so I'll go back to 2019 when Intuitive introduced Ion to the marketplace, and really to the VA. There's over 50 Ion robotic bronchoscopy systems within the VA now. So that gives them that tool, and then complementing and layering that, like Jonathan said, the AI early on to choose the right veterans, right, with the right diagnosis, and then confirming things with the Ion. And then that allows doctors then to say, we need to treat this one way or the other. And as we see it pulled through on the robotic side with Da Vinci, we've seen what's called single anesthesia events, because they know that before they go in, they're gonna run into a nodule. They biopsy it right away, and then underneath that same anesthesia, the veteran could be in the OR or moved to the OR from the endo suite, and then taken care of right there. Then they're cancer-free, literally underneath that same anesthesia, which is awesome. That happened first time out west just a couple of years ago, and it's happening more within the VA. I want to say it's right around 50 cases right now that's happened. So that's just when you sit back and think about that, how quickly that's changed just in the last couple of years. People weren't talking about that 3, 4, 5 years ago, but now the most common stories were, I'm in watchful waiting. I waited 4 years, or I waited 6 years to find out whether or not my cancer has metastasized or grown or not. But now they actually know, and the doctors then can address that right away. So you go from diagnosis to treatment that quickly, and you've streamlined that path of care, instead of it being a spaghetti thing of getting referred here, referred there, referred out, referred in, specialties, so on and so forth. Now you're going almost a straight line from the time you get those early tests and that early screening until the time that you're cancer-free.
Man, and any thoughts on that, Jonathan, before we walk into our next question?
Absolutely. I was just going to add, David, to what Dan said, and that is that we've actually seen with one of our customers out west in Hawaii, actually, where they've told us about the impact of using Optellum's AI to find the right patients for those single anesthetic events. And so that is a great example of where you can use the AI plus the robot, and plus whether it's the Da Vinci or even the Ion, to have that operational and that clinical impact. So yeah, single anesthetic events, I think that's a pretty hot topic.
And excellent. So thank you for that follow-up on that. So Jonathan, it's back to you again. So the PAC Act, Dan talked about the PAC Act a little bit, but why is incidental pulmonary nodule malignancy prediction important in light of the PAC Act? And I did it. I handled it.
Yeah, it's a tongue twister. Yeah. So I think one of the things. So we talked about some of the context behind the PACT Act. You've got these toxins from burn pits, IEDs, various other sources as well. One of the proximate impacts from that is you're getting a lot more veterans getting screened or getting CT scans. And if you're getting a lot more CT scans being performed, especially where there is the lung is in view, you will get a lot more lung nodules being found. So there's going to be a flood of lung nodule patients. And there's a big question over, okay, who do we follow up? How do we prioritize these patients? And so that's where Optellum's AI risk prediction comes in, because it enables you to say, okay, these patients are the ones that are at highest risk of having a malignancy. these are the ones that you need to follow up and do something on immediately. And so it's essentially a way of managing that potential flood of lung nodule patients that you're getting as a result of this.
And you can triage it with confidence, and you can grab those that are in most need and that most risk. That makes a heck of a lot of sense, as we know this is going to continue to grow based on the numbers we're currently seeing. So, of course, I'm talking about AI here, right? And AI is the hottest thing since sliced bread. Everybody knows about NVIDIA, the chips, the whole bit. But, tell us about what makes Optellum unique with its AI.
Yeah, absolutely. So there's obviously a lot of talk and there's been a lot of buzz over the past couple of years and a lot of progress as well, of course, with large language models and a lot of the applications coming from that. In the healthcare space, it's large language models applied to radiology reports or applied to EHR text and things like that.
Yep.
We do that, but what we also do critically is we combine it with deep learning AI on CT images, so computer vision AI. And as we've discussed, that's how you get impact. You combine those two technologies in a clinical workflow so that you can, A, find more of those patients who should be followed up, but B, you know what to do with them. You know how to prioritize them. Otherwise, you're just drowning in a flood of patients. And as a bit of background around Optellum, some of essentially the founders of Optellum were really at the forefront of computer vision AI research. So one of our founders, Mike Brady, comes out of Oxford University. He's had multiple companies that he's founded, all pioneering the use of computer vision and AI applied to medical images. So that's probably where I'd say that is our unique edge and really what sets us apart.
That's amazing. Absolutely amazing. I mean, knowing what's going on in the AI space for sure, just incredible what's going on there, what you're doing with it. So last but not least on your side, and then we'll have Dan close it out. How do you complement? So there's an ecosystem out there, what we talked about. How do you complement other technologies out there like the VA uses, much like Rivervein?
Yeah, absolutely. So Rivervein is a great technology. What they do is CADI. So what that means is that their AI answers the question on the CT image, is there a lung nodule there or not? So the CT image, is it present or is it not? And that's really important.
Yep.
But again, it comes down to that question, okay, what do you do with those patients? You're potentially going to have a flood of these patients. So what our AI does is it answers the question, okay, there is a lung nodule there. Is it cancerous or is it benign? And therefore, what do I do with that patient? And so combining both of those things, they can be complementary and you can have maximum patient impact as a result of that.
Great. So, man, it's so many ways it fits, which is also very powerful. So, Dan, closing us out, I'll pass it over to you. Some final thoughts?
Yeah. So I think the two key things that are important for, I guess, when you look at populations or the groups of people, right? We want everyone to know two things. One, be aware, and then know that they have access, right? So awareness for veterans, the PACT Act does that. PACT Act says, hey, come and get screened, right? We have the capability to screen you. And then now you have access to that care once you're screened and say, okay, how are we going to do that? And the VA now can do that very quickly. So awareness for veterans and the access to care. And then the other piece that's awareness is awareness to the clinicians. So if there's clinicians that are actually on here or VA customers that are listening to this, aware that Optellum and SDV have a solution for you to better take care of your veterans that much more quickly and give them that access to care. The great thing is the contract solution is accessible to you. It's all packaged in. We've worked closely with the Strategic Acquisition Center to make not only just the Vinci products available to them very quickly, but Optellum's products and their contract line items are available on that exact same contract. So we've made it very simple for people to access that. And we're happy to talk to folks, offline. We can contact them. Has the contract already been completed? So Allison,
Yep.
Yes, it's on the VA SAC Da Vinci contract. And then there's costs inside that contract, yes, for those Optellum um, items, if you will, those products, those services are on that contract. And you can feel free to reach out to us on an email or give us a call, and we can guide you to the right place there.
And Dan, a personal story?
Yeah, so I was excited about the fact that back in 19 when ION was introduced, and now that we're seeing all these other technologies and partnering with Optellum, I had a battalion commander who I deployed with in 2004, 2005, just south of Baghdad. And then he went on and subsequently deployed probably another 5 or 6 times after that, both Iraq and Afghanistan. And I think in 2013, then he had found out he had lung cancer. It was undiagnosed for who knows how long.
Yeah.
And then from 13, unfortunately, he passed away and lost that fight in 19. I'm confident that had Colonel Mark Smith had access to these technologies, he'd still be walking the earth with us today. So I share that story with everyone because it's so important, to go, get screened, right? And have access to this, because the power of knowing is so important. It's important for you, not just as, potential patient, but also your family and your caregivers that are around you. It just takes that much more stress out of the process, because now you know of exactly what we need to do, and you get that answer quickly. So, Mark Smith was a great leader. Wish he was here. And I know the technology. The great thing is these technologies are saving lives today because of it.
We need to start getting the VAs to get more fired up and exciting, and bringing them into the hospitals as well. So,
Exactly.
Jonathan, Dan, I thank you so much for your time. Allison, thank you for your questions as well. We're certainly going to get back to you. I appreciate your participation in this too. With that said, thank you, folks. And like Dan said, if you have any questions, you can certainly contact both SDV Medical or Optellum, and we can direct you to the right folks and get you started in your pathway to making this happen and getting this product into your hospital. Jonathan, thank you. Dan, thank you very much.
Thanks, David.
Thank you, David. Thanks, Dan.
Thanks, Jonathan.